Hi, I'm Dr. Sullivan. I'm with Orthopedics at Ohio State. We manage most of the prison orthopedic issues, and we wanted to show you some of the information and equipment that you would need to help get a patient started on appropriate care for an Achilles tendon injury. This is Dave from Capital Prosthetics, who works with the prison population as well, and we're going to show you some of the equipment involved here. So we have a boot and we have some wedges, and there are some tricks to handling the boot. Dave, you want to kind of show us about the boot?
First thing about the boot, especially in the prison system, is it has to be made out of plastic. So it's real important when you're purchasing your boots for each individual facility that you make sure that happens. The boot that we use is a non-pneumatic boot made by Oster, and it's called a form fit. They come small or extra small through extra large, and then we use a series of adjustable heel lifts. We have 3 of them here. These come in medium and large. You'd want to have at least 3 for each boot, and I would get more larges than I would the mediums just because they fit better into the heel of the boot. We'll talk about protocol on how to put those in, and we're going to take the boot apart first. So the upper straps will come off. Oops, sorry. These straps here are fixed onto the boot, and then this piece comes out. So you're going to want to remove the foam inner boot, get it opened up, and these all come with sizing charts too. And before you put this inner boot on the patient, you're going to take all 3 of these adjustable heel lifts. Notice they have removable layers on them. So there's 3 layers to each one, so we have 9 layers. We're going to take that and place it in the back of the boot, like that.
One of the things you need to know about the boot, from experience, it comes with these extra strips here that protect the Velcro. Do not rip those off until you're finished fitting the patient.
The reason for that is this material here is Velcro sensitive, and if you have these strips taken off, this will not go in there. You won't be able to position it properly.
It will Velcro itself where you don't
So
want
once you have the boot on the patient, then you're going to peel these out. They just pull them right out of the front of the boot. That's why they have a little tab here.
Okay, so we have our model patient, John, here, who we're going to say has an Achilles tendon injury. And our practitioner, Catherine, is going to put the boot on John, and we're going to show her how to do it as we go here. So she's going to start off with the boot with the heel lifts in there. Now, is there a sticky thing on the bottom here? No sticky in that one. They will stay in place. Okay, good enough. All right, so then John at this point probably has a pretty sore ankle, so we're going to put this around him, and you're going to relax and let your toes drop down all the way. All right, so his heel is now about 1 inch up in the boot, which is where we want it. So it's going to feel a little bit weird. That's okay. All right, and then you take the boot and close it around him. Easier to do over pants because you can't get your pants over the boot. Okay. So that looks like it fits in pretty well. Okay, and then the next step is to slide the boot framework around. And his heel needs to go all the way into the back, so there's a little stop at the back, and you want the boot slid back as far as it goes. And at this point, the upright should be pretty much straight up and down, fitting comfortably around his leg. So that's kind of the right place. All right, now is this where we take the little strip off?
No.
No, that's not where we take the little strip off yet.
So
okay, so next.
The next step is to fasten the straps over the foot. So now at this point you want to take your hands and grab both uprights Make sure you feel like you have them at midline on the leg and pull one strip out at a time. That white strip, it'll come right out of there. Then do the other side. Then now we're ready to strap up the upper part of the leg. The most important strap is the proximal one, or the one at the top. So what I do, I look at which way the boot is closed up, so it's opening this way. So we're going to want to put this piece of Velcro on the end. There's a corresponding Velcro right here. We stick it there, bring it around, stick it on this side, and fasten it up. So this strap sticks on both sides. The next two just have a little piece of Velcro on one side. So I just keep my straps going the same way. Stick it a little bit to the inner boot, wrap it around. Get it tight. Same thing right down here. And we're all done with that particular one.
Thank you. So an important part of the process is making sure the fit is appropriate. So we notice here that this could possibly have been a little bit shorter, but John's toes are not sticking out over the edge, so that's important. He's not sliding around in the boot. It seems nice and secure. So if we go ahead and take it off. Since Dave did such a great job of lining this all up, the straps all go the right way and this peels up all in one direction. And then when you take the boot off, you don't remove the straps. You just open this out and slide the foot out. Okay. I'm going to switch models for a second and borrow Jasmine, who's much smaller. So this is what we don't want. Just go ahead and slide the foot in there. So this boot is obviously not a very good size for her. Okay. This Velcro will close, but her foot's kind of rattling around in there. Okay. And I have had occasions where this is so big that you can't even get the Velcro, but you can't even get the boot completely over. You have to fold it back or fold it over. So that's not ideal. You don't want to have to do that because that's going to cause some skin pressure. You want to make sure it's nice and flat like that and like that, which, you know, obviously she could do with a much smaller boot.
I think it's important to note as well that when the heel is elevated inside a boot, the foot is not quite as long. Okay? As we start removing those layers out of the boot as treatment progresses, the foot will start to slip a little bit more forward. So it might look a little big at first, but as the layers come out of the heel, the toes are going to start sneaking forward. So you always just want to follow the manufacturer's guideline for sizing. So inside the boot, we had talked earlier that we have three different heel lifts in here. And again, they all have removable layers. And as we start to remove these layers, his toes are going to start to sneak forward in this boot until we get rid of all 9 layers, which generally is going to take about 12 weeks in our protocol that we use. We leave them in all 3 layers for about a month post-injury. And then we start to remove a layer at a time off the bottom by just peeling it off. And this gets thrown away and put this back in. So, put those back in there. And we'll go ahead and put the foot back in. And let's go ahead and take a whole one out. This one.
Go ahead and put it back in. Okay. And now his foot is down farther in the boot.
Mm-hmm. And then let's do it. We'll go ahead and do it one more time, just as we're looking at the foot here.
Okay. So there we go. And we'll do it all over.
Lift your foot out, John.
So every week you'll remove one layer. So
There,
we'll
go
just
and
jump
put your
ahead
foot back
3
in,
layers.
John.
Put his foot back in there. And
Now you can
it.
see his toes starting to sneak out over the inner boot, where before it was back in here. And one more time, John. Foot back in. And this will be the last week of treatment. So now his toes are out to the end.
Yeah, if you go ahead and stand. So that's going to kind of bring everything forward there. More or less. All right, very good. A lot farther forward than it was. Okay.
So John is going to demonstrate how to walk with this brace right now. And you'll notice that he has to keep the boot side knee in a slight flex position to keep his pelvis level. So with an Achilles tendon injury, they're not going to be too anxious to really toe off of that side anyway. So this is the best way to do it without having to order some sort of special shoe for the opposite side. So the knee flexed a little bit, the other foot just comes up to it.